Hi there, my name is Savannah, and this is my video for a postpartum assessment. So first I'm going to start by knocking. Hi there, my name is Savannah, and I'm doing your nursing care today. Can you tell me your name and date of birth?
Marisol Bergstrom, January 28th.
And then at this time I'd be looking at her wristband to make sure that that matches. And then I'd be providing my patient with privacy. I would have performed hand hygiene and put on clean gloves. And so when it's going into the room, you're going to want to assess to see if the patient is holding their baby, if they have support around like their partner or family members, just so that we're assessing the patient's emotional needs. And then we would also be asking, how are you doing?
Doing good.
And then do you have any concerns right now?
No.
Do you have any pain or discomfort?
Not really, no.
Okay, good. And so to start this assessment, we're going to first be talking about your breasts. How is breastfeeding going?
It's been going good.
Okay, and so to start the assessment, I would be exposing just one breast at a time. And so I'd be looking for any cracking, any bruising in the area. And then if I saw any of those signs, I'd be telling the patient that the next time you breastfeed, just bring me in so we can make sure that your baby is latching correctly. And then I would be doing the same assessment to the other breast. And so after that, we're going to be looking at your uterus. And so for this, the uterus should be at the umbilical point. So I would be feeling to making sure it's hard right there, and I'd be taking their hand and they would be feeling it. And so each day it will go down 1 centimeter, which is about 1 finger width down. It should also feel firm. And if it feels boggy or soft, first I'd want to make sure that the patient used the bathroom. And then, especially if it's deviated to the right, that normally means that they just need to use the bathroom and try to void. Yeah. And then next we would be looking at the patient's bowel sounds. So have you had a bowel movement?
No.
And so that is normal to not have a bowel movement within the first 24 hours or so. And then normally we'd give a laxative to help make sure that that's smooth. And then have you had a, have you voided at all?
Yes, like an hour ago.
You have, okay. And so normally that's about 30 cc's per hour. And then I will let the patient know that normally after you give birth, you're going to be voiding a lot more than normal. And that is a normal finding just because your body's trying to get all that fluid out. And so next we're going to be looking at the perineal area. So to do this, normally the patient would use the rails to pull themselves over, but for demonstration purposes, the patient's just going to turn themselves. And so you would just use the back of your hand to lift just like this, so then we would be assessing the area. So we would be looking for redness, edema, any bruising, ecchymosis. We'd be looking at discharge and approximation. At this point, we'd also be looking for hemorrhoids as well as lacerations. So go ahead and turn back over. So now we're going to be talking about your discharge or lochia. So have you, when's the last time you changed your pad?
About an hour ago.
About an hour ago? Okay, and then was there any bleeding or discharge?
Not that much.
Not that much, okay. And then what color was it?
Red.
Red, okay. And so then I would let the patient know that that is the normal finding. It should be red and it shouldn't be too much blood. But if it fills up from front to back within 1 hour, you need to let somebody know. And then after that, it is normal for it to be like a pinkish color from that point on until like the 10-day mark. And then after that, it will be like a yellowish, whitish color.
How long will that last?
The yellow and white color, that can normally last up to about 6 months.
Wow.
Not always, sometimes it's only about 6 months. And so at this point, I would be looking at the patient's legs. So first I would ask, do you have any pain or anything at all in your legs?
Mm-hmm.
Okay, so I would be looking at the legs. I would be looking for and feeling for any signs of edema. I would be feeling the temperature. I would be checking for DVTs, and that all feels normal. And so then if any of these findings were not normal, I would be doing the patient's vital signs, and they should all be within the normal range. If the patient has a temperature greater than 100.4, she needs to let us know. And then also if her heart rate is higher the normal, then that could also be a sign of a hemorrhage, so that is a key finding as well. And so for a C-section, we would be wanting to also assess the bowel sounds. We'd be checking the Foley catheter, making sure that they're still voiding. Again, we'd be listening to all 4 quadrants. We'd be checking the incision site and looking for the Samborita, the redness, etc. Make sure that there's no signs of infection. We'd be teaching the patient that if they need to cough, they need to just cover their stomach, just like this. And then, so those are just some key teaching points for people with cesarean section. And then some other key findings for somebody who's postpartum. You want them to report if they have any difficulty breathing, pain in the chest, if they have a headache that is not relieved by Tylenol, if they have any clots that are larger than a golf ball, you need to let us know. Some clots are normal, but larger than that, they need to tell us. And then if you have a headache, if you have blurred vision, you need to let us know. If they have a temperature, again, greater than 100.4, they need to tell us that as well. And then for my teaching point, I'm going to be talking about breastfeeding and breast care. So for breastfeeding, or for breast care, so if normally your breast will start to fill about 3 days postpartum, and then to support your breast, you're going to want a well-fit bra. You can wear this during the day and the nighttime. If they start to feel sore, you can use ice to put on them. That is something that helps a lot. If a patient is breastfeeding, then you're going to need to tell them to not use the pump within the first 2 weeks, and you don't want to use any formula feeding either, just because within this first 2 weeks is when your body decides how much it needs to be producing. And then those are just like some of the key points about breastfeeding. And then for formula feeding, there's other things that resources that we could talk about as well. If she has trouble, we'd talk with the patient through that. And yeah, that is my video.